is important, and treatment is available. And then I'll talk a little more about our care coordination program in a bit.
Can I ask a quick question? And this might be for the chief, but how are we doing with Narcan? I mean, is our supply, I know there were some.
No problems at all. In fact, the one time that there was a shortage, we worked with the health department and they provided us with 20 doses, so we never had a shortage. So they've been a great partner.
I don't know if now is the right time. I was just talking about COVID, and with the obviously there's been an increased uptick, and then you see that the numbers are obviously trending towards the unvaccinated, and with all of the unvaccinated under the age of 12, given is Franklin County Public Health providing? I thought Columbus Public Schools announced mask guidance. Is Franklin County Public Health behind that guidance? They're pushing it, and just thinking about. I know there's a lot of questions from our school-age families.
Yeah, that's a great question. And so for us, I know that both the CDC and AAP came out with their guidance, and now we know that the Ohio Department of Health is planning to release their guidance either tomorrow or Monday. So we were holding off until we see that guidance so that we can review that internally. And then I was talking to the chief. We actually have a conversation with all of our area superintendents next Tuesday. So we'll be talking further and discussing what those recommendations will look like. I'm sure all of you are aware that if we were to put anything out, it would be a recommendation only. We are not able to put out any type of order or any type of mandates as a result of Senate Bill 22. So it would truly just be a recommendation, but a public health strong recommendation. So
Appreciate it.
absolutely.
Isn't that the bill with the 90-day reprieve though? Is that bill, I'm referring to the vaccination policy bill.
Yes, I think you're, is that 248? I think you're referring to, because Senate Bill 22, it actually went into effect June, I think 26th. That one was that 30-day, or I'm sorry, 3 month. So
Right.
that one already went into effect.
Right. Because the governor himself said that if schools want to go ahead and mandate vaccination within the 90-day period, it's within their legal right to do so.
Yes, yes, and I know that there's the conversation around that one, and I know that the caveat with that is the emergency use authorization. So there's some hope that the FDA will pass that to not be EUA anymore that in fall. So, yeah, I think that's 248. There's a lot of numbers floating around. So
And they
there's
change every year.
244.
Are you having any success with like pop-up events or vaccinations of those 12 to 18? Or most of the pop-up events that you've been holding and that other partners have been holding more directed at adults?
Yeah, so for us, we are kind of directing them to the whole family. That's the strategy we're trying to go to. So when we're at the fair, we're offering both the Pfizer and the Johnson & Johnson. So, obviously those 12 to 17 can only do the Pfizer, and then everybody else, if they chose to, they would like the one shot. So we have both of those available. So we're trying to do more so these family, like the whole unit event. That's what we're trying to do.
Great.
We still have a lot of work to do. We're not seeing the uptake as we were discussing earlier today, even with the incentives and things like that. So we need all the word and out there.
Do you know the percent of vaccination like within our area?
Within Grandview?
Yeah.
Yeah, I do. Let me,
Okay.
I might have to look it up.
Because I
but-
know we have a Grandview hop, and I don't know if that would be something, because you guys, there was an email that came out about vaccinations, like at fairs and things like that. So, but I guess it just probably depends if that's useful or not, depending on the percentage of vaccination in the
Right.
area.
And I can, I'll try to see if I can pull up on my tiny print on my phone, but if not, I can give that to you. I think the last time I looked, I think Grandview Heights was in the high 60s. So, oh, you're so sweet.
But that's a great idea because the hop is coming
Yeah.
up, and the hop, we hadn't had any of them last year, and now we're going to start.
And I think we had two. I don't know the timing, but you
Yeah,
can
August and
both
September.
process maybe through those.
Yeah, there's two, July and
August and September.
August and September.
Yeah.
Thank you.
We are having a booster, Oxford, right?
That's
That was
September.
another event
Yeah.
that there's
Yes.
a lot of younger families there.
Yeah.
There's also another event, but I can't remember if it was food.
I know the fire department was able to get some doses that we have, and it expires August 2nd, and we've put it out, and we've had nothing but 3 people ask for it, and we would even come to your house and administer it to you at home. And there's just no.
Oh, that's a great offering, though, that you'd come to their home. And if there's anything that we can do on social media to boost that, let us know. We'd be happy to. I know that's similar to some of our other fire and EMS partners across the county too, so. All right.
Vaccination station full. I mean,
That's not about, we
I
have,
couldn't.
I know that there's gonna be, there's gonna be things of consent and as well, because I know a lot of, kids will come out. I would control.
We're not allowed to do vaccinations in our clinic, but I find like when I talk to someone, they're agreeable. If I could give it to them a second. So, I don't know that they want to do the work to.
Or create so many barriers. I mean, there's also like storage and preparation, listed doses and all
Yeah,
that.
but I think if they had it at a more casual setting like this, that it's, if people thought about it and talked to someone about it, they might move forward with it at the same time.
So I was able to pull it up. So on average here in Franklin County, we have at least 52% of our population has received at least 1 dose. So here in Grandview, it's a little bit under 72%. So you guys are doing very well here locally.
Are we number 1?
Hold on. That might be a good Oh my goodness, I'm gonna get in trouble. Well, I'm not quite sure about this one zip code. It's saying 125%, so I think some of the numbers might be. I think they have an underestimate of their population, so yes.
100%.
How about you guys are number 1 in my book? So there you go. So you guys are doing excellent when it comes to your rates, so.
Good job. Any other questions? Okay,
So thank you.
So now we're going to shift gears and talk about the paramedicine program, both here in Grandview, and then some partnerships and programming available from Franklin County Public Health. So I think we're going to let Paramedic Smith arrive.
Yeah, well,
Okay.
he should be on his way.
So if you would like to
Yes.
start.
Yes. Okay. So since we're kind of keeping this formal, I'm going to sit here. Is that okay, or do you want me to go up to the?
No, you are fine.
Okay. I have no notes on this. Okay.
Better?
Perfect. Yes. So I'm not going to read off of this. Actually, this is more of our like formal explanation of our program, and kind of gives a little background of who we partner with, how we're funded. But I will also answer any questions you guys have during the. Please interrupt me. So as I mentioned earlier, my name is Lindsay Roenhauser, and I will be talking a little more about Franklin County Public Health's Care Coordination Program. So some of the objectives here today is to discuss a little bit and give you an overview of the Central Ohio Pathways Hub model. That's the model we use. This is the model that we're funded by that allows us to do the great work in Franklin County. Understand a little more about our care coordination program, and then learn about how you can refer, or anyone can refer, to our services. So what is the hub? So the Healthcare Collaborative Greater Columbus, they're actually an agency that is right around the corner here. They manage the Central Ohio Pathways Hub. The Central Ohio Pathways Hub is really a group of organizations coming together to focus on those medical and social services. It's a nationally accredited model that came from the Reddings, Dr. Redding and Dr. Redding, up in Mansfield, Ohio, years back, that really, again, just addressing those medical social services and understanding that social determinants of health matter in one's life. So the hub is represented by community health workers, or CHWs, and these CHWs are integrated into care coordination agencies. So Franklin County Public Health is one of 13 care coordination agencies, or CCAs, within the county. We work hand in hand to address those barriers related to medical social services. By using this model, we are able to fund our CHWs, but then also really increase those optimal health services, but without duplicating those services or referrals. And then also, we like to say we advocate for the client or the resident. And we always want to focus on the health equity lens and increasing health equity within Central Ohio. So some of the core features that I'll be talking about a little bit is pathways. So pathways really are, and I will be passing around too, those connections to medical social services. We have 20 pathways, and I brought a ton, and we'll plan on leaving these behind for you all.
Did you say 20 pathways?
20
You
pathways.
name them? That's a lot of pathways.
I have a slide that will help me. But, you know, when we're talking about medical referral, medical home, we're talking about tobacco cessation, health insurance, housing. These are all pathways that we're talking about. So pathway really is just a fancy word, a tool or something where we can check off and get paid for by the managed care plans. Again, that coordination of pathways, so really focusing on the CHWs, that point of contact for those individuals, those families served. You know, the CHWs for our program, they meet with a client at least once a month, face-to-face. Now, in the COVID setting, we were doing a lot of telehealth, but we can still meet with them face-to-face at a minimum of once a month. And then we also do at least one check-in a month. So that can be a text message, email, phone call. Many of our clients we're talking to them several times a month and texting. We've had clients we started our program 2 years ago. We have some of our original clients still with us. So we also use a shared referral infrastructure, so CCS, care coordination system. It's HIPAA compliant. It allows all the data to be in one setting, and then that data really pulls from the managed care plan, so they can see actually the progress of a client. And then again, aligning funders and payers. So we're funded by the managed care plans. We're funded through grants. We're funded through government dollars. So these are the 20 pathways I was telling about. So adult learning. So if someone is looking to get their GED or maybe their associates, go back to school, we can open up an adult learning pathway. Behavioral health, development referrals, development screenings, that really applies to children. We're also talking education. Education is very broad. Education can be educating them about a social service. It can be educating them about how to be safe during COVID-19, safety guidance. It can educate about where to get the vaccine, finance, you name it, anything really can be an education pathway. Health insurance, family planning, we know that's important. Housing, we talked about immunizations, lead screening, again, that medical home, medical referral, some medication, assessments management, pregnancy, postpartum, social service, and tobacco cessation. So a little bit about our care coordination program. Again, we are part of the Central Ohio Pathways Hub. We are a CCA. We started back in 2019, March 2019. This kind of centered around our community health improvement plan. We started out with, it was myself and one CHW, Rachel Brown. We have now grown to 6 a team of 6 CHWs, and so far we've served over 600 residents in Franklin County and the surrounding counties. That's one great thing about us. We can also serve the other counties. We're not just focused on Franklin. How to make a referral. So this information, there's more information here on the bottom, but you can always give us a call. Easiest way is through our website. We have a job form, a referral. You can provide that demographic information, contact information, and then we just ask what are some of those risk factors so that we can start to prepare before we even reach out to the client. Maybe they're housing insecure. We're looking for needing help with health insurance and navigating that. We can start kind of those conversations and preparing on the back end before we even call the individual to contact them. I also put a QR code because I know those are really big right now, so you can always scan it. It takes you right back to our website. We do have an email as well on the card. The individuals we serve, so for this presentation, I kept it Franklin County residents, but really women 13 or older, men 18 or older, and we can also serve the kids. It's just that we'll kind of enroll mom, dad, guardian, but then obviously work with the kids and get them connected to the services or medical services they need. This is just in this little card. Any questions? And if you ever want to learn more, that is my email there. This is actually my phone number, so you can also, all calls go to me. So.
That's good. Quick question. Thanks, Lindsay. This is amazing work, really important. I mean, you gave the 600 numbers for Franklin County. Do you know if anybody in Grandview has actually utilized the program?
You know, I should have came with that information because I'm presenting to all of you. I can pull the data and get back to you all.
I mean, our question is always, how do we find those people who could benefit? And
Yeah.
In our community, there are some people who have really secure
Right.
situations, and then we don't always know who the really vulnerable ones are.
Right,
So.
right. Well, and so we always say too, is like, even the most secure individuals could fall in a hard place, right?
Absolutely.
And we know COVID showed that. Someone who was very, very secure, maybe lost their job due to COVID, or out 2 weeks and their employer doesn't pay for those 2 weeks. And how are they gonna cover utilities or maybe even just a slight mortgage? I will say, we try to make ourselves visible. We try to put our stuff on social media. We're doing a lot of outreach. Our community health workers want to be visible, want to be in the community. So I would also, if you would want us ever to come out, any events, we can do tabling. We try and make it so that it doesn't feel like they're coming because they need help. But really, we're just here to help you navigate and connect. And I'll be honest, some of the things, even navigating my own insurance, right, health insurance, or finding a new dentist when I moved down to Columbus 5 years ago, it can be challenging. And that's coming from someone who works in the health field. So for someone who might not necessarily understand everything, we're just, again, here to help. So, yeah.
And the referral on the hub website is pretty easy. Like, I had patients, even I'm thinking of our paramedics working around with computers to have somebody's home in Grandview to enter the information in and get sent to an agency.
Yeah, we did a presentation with Upper Arlington's Paramedicine program and have received a couple of referrals through them as well. And so, like I said, all of our CHWs they're trained, they're certified, they've gone through the coursework through OSU's nursing program. We are not, none of us are physicians. When our clients ask about maybe medical advice or things, we always direct them to speak to their physician. But really just trying to navigate, help them with filling out applications, get them connected. So just that source. Some of our CHWs like to say they're cheerleaders or just those advocates for the residents.
No, I'm not a huge proponent of this program, and I think the work that you all do, and I think the state of Ohio, having introduced the hub model and getting it funded, and mandated payments is really unique to state Medicaid agencies for, mandating the managed care plan to pay for it. I think it's good. It's a great work.
Okay. So now we have paramedic Smith that is going to talk to us about the paramedicine program here in Grandview.
This is Firemedic Mike Smith. He is, you
Podium,
can go where you're comfortable.
Yeah, you can sit where you like.
So to kind of give him a little lead in, community paramedicine is very similar to the community health worker. It's trying to fill the need we have in our community, and it could be many things. One of the things that I'm going to give these guys props on is they had an elderly lady at the swimming pool who was passing through Grandview, who was dehydrated, hadn't been able to get to her family doctor, hadn't taken really good care of herself, physically just pulled her car over in front of the pool and walked up to the pool and sat on the bench. She was disoriented, dehydrated, blood pressure was low, hadn't really taken care of herself. Somebody called the medic crew went down, recognized this, checked her out. She refused to go to the hospital. Her vitals really weren't in the range to where she was in an emergent crisis.
No, she wasn't acute, so.
So what they did was drove her all the way back home to Galloway and made sure she got home to her family. We put someone in one of our staff cars, took her home, and then the next day, Mike followed up with their local fire department, who's building a community paramedicine program too, referred this lady to them, and they're helping her get to her family physician and getting her health regimen back on track. So
Yeah.
to me, something so small made such a big difference, but it's a great example of all the hats that we wear. When someone asks for help, we find a way to help. And that's really what community paramedicine does. If we don't have a specific emergent need where they don't need a hospital transport, a medicine, some great big intervention on the EMS side, that's where Mike's specialty comes in. And I really look forward to him.
Well, so community paramedicine actually got its start about 15 years ago nationwide. Some communities started seeing some issues with recidivism with patients, which we all frequently call them frequent flyers. We see them a lot. Usually the same fall. They may not necessarily need acute care or a trip to the emergency department. They just need some sort of assistance at that time. So places like Wake County, South Carolina started this program. MedStar in Fort Worth, Texas started a program. I can't remember, it's a sort of a Native American term up in Minnesota, started a program. And their goal was to make paramedics sort of advanced practice. They found out, no, they really don't need to be in advanced practice. They don't need to learn new skills. They don't need to have a different scope of practice. They just need to start specializing in certain areas where patients that are the frequent utilizers. What can we do to either get them to the proper care or get some assistance at home for them? And they found out that it became more of a social local area problem, and they started reaching out to different agencies. In Ohio, community paramedicine got a very slow start. We're not as cutting edge as what you would think we would be. 5-6 years ago, the EMS board recommended to the state board of EMS that we allow paramedics to operate in a non-emergency situation, which then opened the door to community paramedicine. Our scope of practice hasn't changed. Having a protocol and a medical director hasn't changed. Having direct impact with a physician hasn't changed. We are the eyes and ears for physicians out in the community. When somebody calls 911, we go out, we assess the patient, we make a decision whether they're acute, need to go to the emergency department, or can we reach out to their primary care physician and see if we can get them in there. I don't know how many times I've called physicians around here and said, hey, we're here with Mrs. Smith. You know, she was supposed to come in for an appointment yesterday, missed it, she wasn't feeling well, she called us, and she really doesn't really need to go to the emergency department. And you give them an assessment, give them vital signs, give them your workup that you had for them, and I've never been turned down from that physician saying, send them in, get them here somehow. And that's worked out very well. When Chief Shaner was here, we talked about doing community paramedicine, we just didn't know what to do. Chief Ussenacher came from a department that had a community paramedic. As a matter of fact, the first community paramedic in Franklin County. And he expanded their program to do all kinds of really great things. So he's like, what can we do? And I said, well, let's start out with our frequent utilizers. And we had a gentleman that was calling, I think we counted 16 times in about 46 days. He was confused about what he needed to do for his health. He was confused about what medications he needed to take and when. I called his primary care physician, talked to the nurse practitioner, and she said his medical literacy is so low he doesn't understand this. I said, well, we're going to work with him, see what we can do. And he was diabetic, had hypertension, had asthma, and he may have had some substance abuse issues in the past. Currently, none. I called him up, said, hey, how about if I come down and visit with you? His sister came, and we sat down and talked, and I asked him, what's this medication? He goes, I don't know. When do you take it? I don't know. I said, we're going to work on that. And we educated him right there about medications and stuff like that. And we started getting on the road. I reported back to the nurse practitioner. She said, if you can get him to do one thing right, it'll be great. The next lady we were seeing, she was calling, she lived in a very wealthy area. She was falling a lot. She had vertigo. And it was always vertigo that caused her to fall. Always caused her to fall. Always caused her to fall. It wasn't that she had a cluttered space, because she didn't. But she wouldn't use the tools that she had. She wouldn't use her walkers, even though walkers were all over the house. And she ended up calling 13 times in about a 3-week period of time. And so I reached out to her primary care physician, and they were very much, yes, she needs this, this, and this. If you can help, let's see what we can do. And we were able, through working with her family and her medical powers of attorney, her primary care physician, we were able to get her round-the-clock care at home. She did not want to leave her house. She said, I'm going to spend my money, and I don't care where I spend it, but I'm not going to spend it in the nursing home. And she hired round-the-clock care, and she now has round-the-clock care, and we've only seen her once when she brought Anthony Thomas candies to us. So, community paramedicine in Grandview Heights is just getting started. Another name you may, if you're doing research on it, is mobile integrated healthcare. It's a lot of stuff. People really don't understand what that's for, community paramedicine. Everybody knows what a paramedic is. Everybody knows what the community is. I currently work, in Central Ohio, most of the community paramedic programs that are going on in fire departments are for frequent utilizers. You know, you don't think it's that big of a to-do, but if you're tied up on somebody that has fallen over and over and over and over again, there may be some other patients that really need your care at that time that are being neglected. So that's what they really started doing, and they've expanded a little bit further. Upper Arlington's got a great program. Truro Township has a program. Violet Township has a great program. About 5 years ago, when I left teaching paramedic programs, I was asked by another employer that I have, Ohio Health at Grant, to write a curriculum for community paramedicine, because that was a big thing. You know, Ohio finally said, hey, paramedics, you can go do this. Not change your scope of practice, but we also knew that we needed to teach paramedics about how to get a hold of social work, how to get a hold of addictive counselors, how to get a hold of fall risk assessments and things like that. So we gathered all this information, we wrote a program, and was getting ready to release it when, at a meeting of a bunch of fire departments, one of the chiefs says, how do we pay for this? And I said, Chief, unfortunately there's no revenue stream in Ohio right now. And out of 120 people on our wait list, when we went to seat the class, we had 2. Because there's no way to pay for this. So that turned into, well, I guess community paramedicine as teaching has died. I said, but we are a hospital system. We have problems with people getting readmitted. And they said it's a huge thing. So we turned that education program into a community paramedic program with some assistance from some cardiologists at Grant and some stroke teams. We now have a community paramedic program at Grant Medical Center that we have been seeing patients for about 2 years. Again, we're not superseding any physicians or any nursing care, we're working with them. And in fact, 90% of our referrals come from congestive heart failure clinic, neuro docs in the stroke care, diabetes care, and that's how we get our referrals to our patients. Prior to COVID, we had a really great track record. We reduced readmissions for congestive heart failure. The top 5 frequent utilizers, we reduced their readmission from 120 days out to 180 days. One of them came back in at like 181 days. The rest of them did not come in for an entire another year. They were making their appointments, they were seeing their physicians, they were doing all the things. We found out that people feel more comfortable at home. Huh, imagine that. You know, their blood pressures aren't high when they go into the doctor. When we go there and talk to them, they're sitting in their living room, sitting in their kitchen visiting with them. They're able to ask questions. They feel stupid asking questions when they go to their physician's office or to the nurse. So we're able to answer questions for them. And that's what I see going on here in Grandview, that we be that little wedge in there where patients are falling down. They're not, you know, primary care physicians may not have seen them for 3 or 4 months. You know, we can reach out and see them. I see a big help. We've got an older population in Grandview. They have heart surgery. We get in touch with them, teach family CPR, teach them how to use an AED. Go out and visit them when they come in the hospital, make sure that their incisions are healing well. Being that sort of that interactive part that, okay, you just had your open heart surgery, the nurse is going to call you in a few days, make sure everything's going okay. You're going to see the surgeon in 3 weeks to take a look at your chest x-ray and your CBC and make sure everything's going well, and that's it. We can be that next little portion that we can go in and see these patients, answer their questions. Why does my back hurt so bad after having open heart surgery? Well, because I did this to you. And all those ribs are now, you know, stretched out of place. You know, that's going to be a 6 or 8 week process for getting back. And people don't understand that. They probably learned it when they were in the hospital, they're just not paying attention because so much stuff is going on. So that's where I see community paramedicine going on in Grandview. We still have our frequent utilizers that we see, but guess what? We're working with them, we're helping them out. So, questions? Did I answer everything that you guys said? Did you have a question?
No, I just think it's great. I mean, you know, I like how the way you model it. And, you know, it's tough. I think with the work that community health workers are doing, and I know that they're getting reimbursed by certain funding sources that you all. I mean, I think you drew a distinction. I think, you know, and maybe you've worked in rural communities and maybe you've worked with different, you know, the way the state of Ohio did it, not increasing and not touching, you know, kind of scope of practice
right.
and utilizing, you know, through working with primary care physicians. I think, you know, it is what it is at this point. But I don't know, like, is Grandview funding? I mean, I know there's a Board of Health meeting here, but well, use our tax money.
I know Mayor Kearns is very optimistic. We're working. We're kind of trying to react with our need right now and see where this takes us.
Yeah.
Our community is very, very unique. We spoke about different, you know, characteristics of this community. So we haven't found that clear-cut niche yet.
Right.
And we're getting the word out. We're dealing with things that we come and we're reacting. But we do have an opportunity to pursue this.
There's lots of different models in Central Ohio as far as having a community paramedic. You know, could you have one on each crew? You know, and they just see patients on that crew, schedule patients, go see
A
on that crew.
specialist.
Right. Have, you know, one person that doesn't work on 40 hours. Well, that's another, you know, you had to backfill their spot and different things like that. So there's all kinds of different things out there, and a bunch of departments have tried different things. So, you know, I'm in touch with all of them, and we talk about different things and trying to figure out what's the best effort. And we don't know that yet for Grandview. We don't know how it's going to work for Grandview.
It puts Mike in a tough spot, and I'll give him a pat on the back because he's assigned to a shift. He works 24/48. So this is something he's doing above and beyond his duties as a firefighter paramedic here at Grandview. So he has early mornings, he has late nights, he has a lot of things on the weekends, but he also has some people on some other shifts he can count on to go make a visit if he needs to. But right now, Mike's doing this above and beyond all his other duties as a firefighter paramedic. So he's got a lot going on.
Good.
No, you first.
So how can the members on the Board of Health help you guys?
Well, right now, we have a few contacts as far as the presentation you had and things like that. So as we move forward into this, we'll need a list of contacts. I've got contacts in Franklin County that I've used through Ohio Health that can be brought here and stuff. But if there's anything specific to Grandview, then that's what we would need eventually. At this point, not so much.
And I think advocating, getting the word out, answering questions in the community, when you hear an opportunity in the community, call the firehouse and we'll go right out and we'll follow up with them. But I think advocating and getting word out that Grandview can provide this unique service is where we need to start right now.
Absolutely.
One of the unique features of Grandview is that, we don't have any major hospitals or anything in our boundaries, so you don't have that immediate partner to say, hey, this is gonna save you a lot of money on ED.
That's a really good point.
I mean, we do have that urgent care facility in the yard, and I wonder, about if they've been part of these conversations.
They have not yet. I do have a pending meeting with the medical director at that urgent care, just to touch base and to talk about things. The good thing is, right now, with Ohio Health being the only hospital-based community paramedicine thing, we're getting contacts that way.
Yeah.
And at Ohio Health, if we get a referral to a patient in Upper Arlington, we call Upper Arlington, says, is this person in your service area? Can you go see them? Or refer patients to JD Postage of out of township almost monthly because of that. And we can expand that this way. But as far as reaching out to other physicians, we haven't done that yet, other than the fact that we've got this frequent utilizer, we're going to call that primary care physician, talk to them. So that's our next step.
And being mindful of the fact that you're doing this in addition, right now, this is a work in progress.
Right.
I mean, are you able to do any data collection currently so that when it does come, we need to show the efficacy, we have some longitudinal data to say, we've brought people around?
Right. We've actually, every run that I go on as a community paramedic, we log that as a different type of run number, so it's easily searchable and we can find that information, that data. It's a very simple queue to be able to do. Right now, our numbers are so low that it's easy just to search those out.
Right.
We've seen 12 patients in the last 8 months or so. Yes.
I see patients with diabetes all the time. That's amazing. Like, I didn't know this existed, but I have probably a ton of patients I would send just to get accustomed with their medications when they go home, double check they know how to do it. But how do you get that connect between the physicians or the nurse practitioners or even the nurses to you? Like,
that's a workflow thing that we're gonna have to work out and figure out. I've been putting information together and thinking, okay, when we get ready to roll this out as, hey, we're finally here, we're gonna do this as a regular thing, that we would reach out to all the physicians in the area and say, listen, this is what we can do, this is how we can do this. If you have a specific need right now, you can just call the firehouse and put the word in and we can go and make contact with those patients. Diabetes is a tough one. I'm a diabetic.
So tough.
Yeah. You can't tell by looking at it.
And people get overwhelmed at the visit.
They
so
do.
It's nice to just have another person check back in.
Right,
with them.
absolutely. And another diabetic going to visit with them is a really big thing, especially a new onset diabetic who thinks that their life is going to go around like this all the time, so they have to keep poking their fingers, right? And that's a big thing. It's changed so much. They don't understand that, hey, if I take this pill along with this insulin, it's going to make my blood sugar do this.
Yeah.
And by going out and sitting and visiting with them, listening to their questions, answering them, and being in their residence, I think is a big help. Big help, because they feel more comfortable with it. So we'll have the ability to get you in contact with us.
Yeah,
very soon.
or maybe just a way to publicize it through the community. Like, I think just post-operative checks, things. I don't know if people look at Facebook all the time, like the people that need this.
That's our biggest avenue of connecting with our community, and you're right. It's not a slam dunk.
I don't know if there's any other ideas, but all these things are great, but I don't feel like we have a way to deliver.
Well, should we have a liaison relationship between paramedicine and the board? Maybe a physician on the board that could interact with you guys?
That's higher my pay grade to make that decision. Yeah, I think that may be in the future.
Mike, I know you guys are busy. Thanks for coming in.
Thanks,
I
appreciate it.
appreciate it. You did a great job. Thank you.
Have a good evening. Thank you.
Thanks for all your hard work.
Thank you, guys.
He really does wear a lot of hats.
I didn't sound so.
Mike Smith is the best paramedic I've ever met in my career.
Got tons
And
of-
his career is not long in Grandview, and we would do well to have him involved in that program as soon as possible. To get his earmark on it, his watermark, because that was up longevity for, but that's all.
Awesome.
Thank you, guys. Be safe.
Thank you.
Somebody talking about me like that.
Yeah.
After I'm done.
I'm sorry, I can't say that, but maybe next meeting.
So, yeah, there'll be other questions that pop up. We're here. I'm available at the firehouse. You're more than welcome to stop in. You know, we are in the beginning part of this, so we're trying to very carefully gauge things so we're not overwhelmed too fast while we don't have things established, but it's a very worthwhile thing to take on.
Is that something that, like, I know there's senior activities, things like that, just like maybe a paper more that people could pick up? And
We've worked with Marta, we've talked to her,
Okay.
she's referred someone.
Okay.
We've even partnered her with Mike on a couple instances. She had a resource of a home health company that helped get grab bars for a lady shower. So yeah, Marta's been a huge help with her senior contacts. So.
We also have a presentation from Teresa. Is that, no? Okay,
I
it's
don't
on.
think so.
No.
Okay.
So Teresa and I were going to kind of join forces
Okay.
and do this, but she
You
said
and I
I
together?
Yeah.
Okay, great. So along with the communication piece, Aubrey has been working on a flyer that's going to get pushed out as a Board of Health flyer, and it's still in the draft phase, so I'll email it to you because she was working on some dates. But the topics that we chose are back to school safety, talks a little bit about traffic pattern changes with the high school being in the new middle school, and so walking is going to be different. The chief is putting together, working on a babysitting class for,
Kind of tweens,
I forget what age group.
we're thinking 6th to 8th grade, and I
Okay.
almost want to gauge it for the age of kids when they start staying home by themselves. I think we can do a kind of multi-purpose.
So it was going to be a one day or one afternoon program.
Yeah, include lunch, make it fun. It's a 4-hour curriculum, but we'll try to build some activities around it. Maybe work with Parks and Rec and make a really cool experience out of
Obviously, immunization is on there and getting information out. And the fourth topic is escaping my memory at the moment. It'll come to me, I'm sure, as soon as we wrap up here. But she's using Franklin County Public Health information because they have most of the programming established already, but it's going to be a way to convey this out. I think paramedicine might be a great topic too. We're thinking quarterly right now. And then, so if you have ideas going forward, Aubrey is the one that's putting it together. But I am going to send it out to get your feedback on what's there.
So a conversation happened and these topics were chosen somehow?
Well, yeah, and I sent an email out asking
Yeah.
if you had input on the topics for the first one.
Yeah.
And so these are the ones that we went with.
And this is just a promotional flyer to the community?
Yeah, going out to the community, these are things that Board of Health, alert the mosquito spraying, because that will start up again. It gives links so people understand what's being sprayed in that program. So that's for the first one. The next one will be coming out in winter. So start thinking of things that you think, either programs that are existing that we need to make sure people are understanding that this is here. We can do the community health.
That's exactly what I was thinking. This
I
needs to
think
be
that would
front
be a
and
great
center.
one, because I'm sure they're, I didn't know that
Yeah,
this
me either.
existed, I'm not a physician. So, whatever you think you need to include, Aubrey is willing to put forth the work to get, it's just a one-pager. And the other thing that we need to help publicize is Franklin County Public Health also provided larvicide tablets. So if you know people who have gray barrels, mosquitoes are going to start, the upswing seems to be happening. And they're free. So they just go to the municipal building and
And I'm sure Aubrey's gonna put it out on social media,
Yeah.
we'll have hard copies and like you
She,
said.
I know
this
she
would
did
be-
one push already, and she said some people came in, but I think, we were given $50 and $25 if you order them yourself, so these are free, for the public. Or for the Greater Red Darkness, so, you know, anybody, like, can take advantage of those, that's the other thing that helps.
If you want to reach other people my age in public, utilize the library.
And the library.
I've never been on Facebook. I thought it was my face, my MySpace. So no one comes down the hill, down here in this municipal building, it's very good to see. All the Q-tips, all the people, like, they go to the library, and so, that's a great resource, it's a 5-star library.
And the library, the director of the library, we had a conversation, and he said he would be willing to do, like they do the educational, displays on birds, and there's things that you can pull out. We could put together some information there as well. It just takes a little bit of planning. So yeah, those are things that are available.
I think, no, I think that's great. I think that the communication piece, it was about the email that I run, I'm not really, and I figured to bring it up, I'm not really sure, I like the board being behind some of these great programs, and I think it would be good to make sure that we know, obviously this is a great presentation on community paramedicine. So now I feel like we have knowledge of it if people ask. But there's a lot of things that Grandview, health-related decisions that Grandview makes from the guidance of Franklin County, but about the opening of the pool was gonna be a delayed opening, and then they were anybody can come, and there's a lot of people that are under the age of 12 that are pool, unvaccinated, without any limit. You go down there on the weekend, and it's just packed, It just seems like a big, so I have people oh, I can't believe Grandview's pool is open, what is the board, and I'm well, we don't get that. And so I'm not saying that we need it, I'm just wondering if we need to create that space of knowing big health-related decisions that are going on in Grandview.
We're not, we contractually.
Sure.
And keep in mind, Mayor Kearns has department heads that do heavy research, and they are paid to make those decisions, and that's in their job description, and that's their job. So they do work with the professional health organizations to make those decisions, and it is their job.
And I
to
don't
do
want to
that.
make the decisions, but I feel if we're a community board, then when do we get notified so that we can represent it to the community or provide community feedback on whether we think it's.
Yeah, we find out through the same text messages that the community finds out.
Absolutely.
And professionally, there's an assumption in the community, and maybe it's just a clarification thing. For example, the website has some language about the Board of Health that really isn't correct in terms of the decision. We need to be careful about that. But I would also encourage, I was rereading through the city code recently, I would encourage council to go back to city code and make sure that it says that the scope of where decisions are being made is actually adequately represented. City code actually says quite a bit about what this body does that I don't think is actually what this body does. So it'd be nice to just be clear, because also we're volunteering and we're professionals who I think people assume we're in the know when we're not, which is fine, but we need to make sure that it's represented to the community correctly in terms of where decisions and who's being consulted and all of that.
Even more so, our names, professional names, are entwined, interlaced with all the decisions that we do not make. So we make no decisions here other than voting once a year on a contract, which is a slam dunk. Right?
Well,
We're not gonna vote against the contract. So people just assume that we are making decisions. So from a professional standpoint, it's awkward.
Well, I understand that, but remember, we're counting on this board to make recommendations to us.
Right.
Do you see an opportunity? Do you see something that needs clarified? Is there something that's not getting disseminated in the community? That's we're looking for you to guide us in that, being from the community, to see if we're overlooking something. That's what I think.
Well, we're asked to stay in our lane, which I understand. But again, it's dancing. People in the city think that we are making these decisions, and so they're stopping us and asking us, why was the pool closed? Was it closed? I didn't know that. So it's it's awkward from a professional standpoint. I'm a retired guy, no big deal. These guys are practicing professors at universities and active physicians in hospitals. So it is a bit awkward, and then on the website, it does say that the Board of Health oversees Franklin County. Does anyone here think we oversee Franklin County? So, we just don't oversee. That's the first thing it says. Board of Health is one of our first responsibilities is that. Again, it's just a professional awkwardness.
Have you like emailed this to Mayor Kearns or visited city council to say, these are,
Well, we're all part of the Board of Health, and we should take it together.
I-
Or like, these are viewed public meetings, I'm sure Mayor Kearns.
Yeah, I would never show up to a city council meeting on behalf of the Board of Health, or even
Well,
as
I
a Board of
think
Health
that-
member. I don't
But
think
it's fine.
But I mean,
we
you
can-
said,
we
just
can-
an email, can we have a conversation? Something
Sure,
along those
absolutely,
lines.
sure. But we can stay in our lanes, but make it clear on the website that we don't make decisions. Make it clear that we vote once a year on a contract, not on, why weren't masks worn until May, that kind of thing. So just make it clear for us, and then it's just a little bit more palatable for us professionally to, again, stay in the lane. We have these nice discussions, and we can, throw out 2 cents or 1 cent, in 1 cent in. But that's the problem I have, and I think some of the other members have, is that we don't make decisions, yet our neighbors think we do. And in the past, it was an attorney or 2, and a chiropractor, and a retired nurse. Now you have 2 PhDs and 3 MDs on the board, so we're active, most of us, professionally, and it's just, again, it puts us in a weird spot. I've had that complaint from a couple board members for a year and a half now, so. Is that accurate, guys?
Yeah, no, I think, Chief, you brought up a point about, bringing these concerns and stuff to us, and I think that that's a fair, and I think, when it could be, if there are decisions, health-related decisions that are being made or decided upon people who are paid, all of that, which I absolutely respect, and I obviously respect the great work Franklin County Public Health, but if they're gonna have it in Grandview, it could be like, let's use the belt board, should the Board of Health be a sounding board for those decisions, or not really? I mean, if it's not, we're gonna make the decisions, and then, we can come to a meeting quarterly and
Yeah, I mean, all the medical decisions that we make are based on our medical director. All our COVID decisions were based on the CDC and Franklin. We're not making unilateral, I can think of very few times we've blazed a unique trail that isn't based on some standard within Central Ohio.
Yeah.
I mean, I do see what you're saying, but I just don't see any instances to where we've really gone off and done something so different from the communities around us, or so different from the recommendations of Franklin County, or they really are based on those standards, but.
The decisions have been great, and I mentioned
Yeah,
earlier.
I feel like they have been.
We're one of the first 6 cities in the state to come up with a mask mandate. And so I commend the county and the mayor, and we didn't make the decision, you guys made the decision. It's just, I would just want to make it clear. I just want my neighbors to know I don't make any decisions here. That's all I want. And then I'm happy coming here and chatting, and it's I learn things, but again, we do not make decisions. And so I don't want anyone misled on the website or with these meetings, and that's it. And then we're good. We'll still come and say hi.
And to that point, I was gonna say, I could talk to Aubrey tomorrow when I get into work, or even shoot her an email and start the communication. I think it's not simple, but I think one of the first steps is to just maybe update the website a little bit to be a little bit clearer.
Yeah.
And I think that would help address some of your concerns, not all, but I think and I'm just using an example, maybe advisory board, or I'll let her run by the verbiage.
Yeah, we should leave that up there.
But maybe she has better suggestions on how maybe it could be properly worded to be a little more clear to the community, to the residents. So there's less confusion.
And again, you guys are doing a great job across the board. I mean, I can't think of one thing that that I had an issue with. But.
Yeah, I don't think any of this, and I'm glad we're having this conversation. I raised this at a couple of meetings, and just kind of being unclear about the scope of things. But I would say, communities change, and it may be. And when I was first appointed to this board, Mayor DeGraw at the time said, "Well, they really meet. They met kind of once a year, or like but it's really ramped up." And of course, we've been in a pandemic.
Right.
So it may be that we've learned some lessons, and we're all very increasingly prevention-minded.
That's a fact.
And it may be that we need to, and that's why I mentioned I really would encourage council to look at the code, the actual law, in the city, ordinance, I forget what it's called. Because it's pretty broad and pretty different than, so it may be time for a look at that. And maybe this body changes, and maybe this body becomes something else. So, because we all want to help the community.
Yeah, and I know.
That is our goal.
And we're, there's not many, I think we talked, Commissioner Mazzola was here one time and said that I think out of the district, or the cities within Franklin County, we're not many have a board of health, right? It's like Arlington.
We have 3.
3, right?
Mhm.
And so, and a lot of people have disbanded them because they get their, so we maintain it, and it'd be good to reconsider. And I've worked on, I've worked with a lot of community boards. I think it can provide great feedback and access, and that's sort of, sounding boards for decisions that are being made. Sometimes there's blinders on when you're working. So, yeah, it's good.
It's good.
And I Franklin County Health has a community advisory board, or I'm on their equity board and all that. So they have a lot of committees that are making good decisions. So, yeah. You can also learn from some of the other board of health too. Get together with them. See what Arlington or Bexley or whoever has.
Yeah, you got them too, yep.
Yeah. Thanks. Good conversation.
Thanks for your comments.
Yep.
Just to verify if this works with everybody, I'm looking at the next meeting before we,
Sure.
October 28th would be the 4th Thursday, and that would be plenty of time to get the contract from Franklin County and get it signed by all our appropriate staff and administration.
Maybe we said October 28th.
Yeah, that's what I'm looking at. I just want to make sure that works for everybody.
Sounds good.
Yeah.
I know.
So it's not going to be
I
a
don't-
trick or treat type of night or anything like that.
Yeah, I don't think it's going to interfere with any holidays or Halloween or.
It's
So I
too
think
hard
we
to
should
think
be.
that far ahead.
But what I'll do is, I believe like I do, I'll send out an email reminder, add it to your calendar.
That'd be great.
And it'll be in person. We're out of Zoom now, so.
Maybe, we'll see where things go.
Yeah. Let's hope we stay in person.
Yeah.
That's.
Can I make a move to adjourn?
Yeah.
My last.
All in favor?